Salutations, respected viewers. This video is about why all countries should have universal healthcare. So what is universal healthcare? Well, that would suggest that healthcare is available to everyone regardless of ability to pay and would be publicly funded through taxation. Now, I'm not against private healthcare as well. That can exist. Beside it, people can opt to use private healthcare, as I have myself from time to time, even though public healthcare was available to me. Well, why should universal healthcare be available? You may have heard of the Universal Declaration of Human Rights, issued by the UN, to which all sovereign states are signed up, and it says that people have the right to healthcare. So is healthcare a human right? I think it is. If it's in the UDHR, then it must be. There are numerous other human rights instruments issued by the UN to which virtually every country has signed up, which say this. And these countries as signatories have mostly ratified these treaties, as in put them into their domestic law. There are lots of continental human rights instruments which also state that people are entitled to healthcare. Most constitutions will say there's the right to life. Well, the right to life is ineffective without healthcare. Now, obviously, people are not immortal, so governments cannot guarantee the right to life in that sense, but insofar as possible, governments should try to keep people alive, which is different from mandating them not to do things which are a little unhealthy. So I realise that this wish to help people stay alive shouldn't be carried too far. Like we could extend life by saying it's mandatory to eat vegetables every day, and I wouldn't propose that. Now, governments mostly provide emergency healthcare. They have ambulances and things like that. Going into an A&E unit is usually free. The low-paid can't afford private health insurance or healthcare otherwise, especially in many less economically developed countries. You might say, well, get a better paid job or work harder then. Often these people doing the very low-paid jobs as farm labourers, as cleaners and so on, they do work hard, but their rate of pay is so low that they don't have much discretionary income and they can't afford healthcare. Somebody has to do the poorly paid jobs. Society cannot function without people doing jobs of this nature. Another point is soon mechanisation will mean many of these jobs will disappear. Robots will be doing these jobs. So what do we do with those people who are then out of work and can't afford healthcare? If morality means anything at all, surely it's saving those who are in danger of death, often through no fault of their own. And it is affordable. Look at a country like Cuba, not wealthy at all. For decades, it's had completely free healthcare, free at the point of access. There are lots of bad things about the Cuban government. There's lots of repression. But in this way, it is righteous that it provides healthcare to the needy. Or Sri Lanka had a monstrous civil war all through the 80s. Hundreds of thousands of people killed. Not an affluent country, but even then they had publicly funded healthcare for all. So it is doable. If countries like this can afford it, then wealthy countries can certainly afford it. The way to do this is obviously through taxation, and the affluent can afford to pay more, should have a higher rate of taxation. I would think that that really goes without saying. I don't hate the wealthy. I'm not against people having billions, but an extraordinarily wealthy person might have to make do with 9 billion rather than 10 billion. And no, I don't think it's going to wreck the economy. I'm aware that if tax rates get too high, then that can have a negative impact on economic growth. But there are many examples of high tax economies like Sweden or Denmark, which still have healthy and steady economic growth. Private health care can also be quite inefficient. You should listen to some of the orations of Dr. Stein, who was a leader of the Green Party in the United States, saying you have to count every bandage in private healthcare and work out, is this covered under the plan or not? And then so much time is wasted on admin and it drives up costs. And also people are competing between various medicines, and people are asking for medicines because they've seen the advertisement, not because they know what's best, and not trusting the professional's judgment. And doctors are paid by health insurance companies for this and that. I realise it's not as bad as it was till about 20 years ago when Clinton regulated a bit in the US. And there's obviously a perverse incentive for private health insurance companies because they're driven by profits. So the best thing for them is if the premiums are as high as possible and the cost of care is as low as possible, and ideally people never claim care at all and just die of a heart attack and that's it. So the company made a huge profit and didn't have to pay out any costs at all and find excuses to deny care because of a pre-existing condition and so forth. I know the Affordable Care and Patient Protection Act in the United States slightly sorted it out. Private healthcare doesn't have to be exorbitant, doesn't need to be exploitative. Republic of Ireland, where I'm from, there's private health insurance, and it's not too bad. People don't moan about it that much. The poorest third of the population have medical cards and they receive healthcare free of charge. With ageing populations and more expensive treatments, obviously that the cost of healthcare is going to go up and up. France has got the best model. I know people snort derisively at the very name of France, but there's a lot about France which is not contemptible. It's been calculated to have the best healthcare in the world. Such a high life expectancy, despite a fairly high lifestyle with fatty food, high rate of alcohol and tobacco consumption, and too much sunbathing. But the doctors are not well paid, and there's so many doctors per capita, and healthcare is free at the point of access. Of high cancer survival rates and so on. So I think the French model is the one to follow. The NHS in the United Kingdom. Of course, it's got its flaws, but overall, it's brilliant. My experience of it has been almost entirely positive. Walk in, and I know the hospitals, they don't look like five-star hotels, but they're not supposed to be there for show. It's not a business to be attractive, it's to provide a necessary service. And in that regard, it's fantastic. I admit it's probably too bureaucratic, but you get that in the private sector as well. And in somewhere like the United Kingdom, if you wish to go private, of course, you are entitled to do so. So I'm not trying to outlaw private healthcare, but just say that everyone should have it. And in some countries, such as the United States, there's enormous distrust of the government. And if you say something is governmental, then people tend to be against it. This Republican pollster, Dr. Frank Lund, said, if you call it public healthcare, people will go for it. If you call it government healthcare, they'll be against. Just because it's run by the government doesn't mean it's have to be bad. Like in places like the United States, if Medicare and Medicaid were rolled out across the whole population, it would be much better. It's been shown that the Veterans Administration in the USA treats patients per capita much cheaper. The hospitals are all built to the same plan. They bulk buy huge amounts of medicines, which really cuts costs as well. So at the moment, probably some countries can't afford it, but that's a goal that people should be working towards. And if governments have ratified these international treaties, then they're legally obliged to take steps towards it. It shouldn't be controversial. So every country signed up to the principle, but some countries are not making enough progress. Or rather there are enormous profits, or rather that the super wealthy have to pay less taxation. If someone is dying in agony, we could easily say that person, should we? I say that we should. It appears to me to be a no-brainer. So I wouldn't oblige people to be healthy. I would draw a distinction between voluntary and involuntary suffering. I'm not trying to prevent people smoking or drinking and doing things unhealthy like that. And in fact, as they die sooner, they take the burden off the healthcare system. But I think that healthcare should be available for all. We have this with education, because why do we have governments at all? Well, we're social animals, we form communities, we call them countries, we face common problems, and therefore it makes sense that we tackle these in common and try and sort these things out. Now, no system will ever be perfect, and of course there are weaknesses with public healthcare, and private healthcare doesn't have to be terrible, doesn't have to be too expensive. But in some countries, certainly it's too pricey. So that's why I urge people to support public healthcare as a right for all.